Welcome everyone to Let's Talk Aesthetics. Today we're going to be talking to a surgeon who is going to be making some aggressive changes but create some beautiful, subtle results. So let's go and talk with Dr. Fatima and learn how she actually does it. All right, welcome back to Let's Talk Aesthetics. So I'm back again with another amazing doctor that we're going to be talking a little bit about, get to know them a little bit and ask questions. If you have questions, make sure to just, keep posting them, send them. So let's talk with Dr. Fatima.
Thank you so much for having me here.
Welcome. Thank you so much for giving us the time.
That's my pleasure.
So tell us a little bit about yourself.
So I basically started off, wanted to become a plastic surgeon,
Okay.
right? Did my general surgery. And hoping to get into plastic surgery, the aesthetics field kind of just amazed me by how it actually just came up really nice. And suddenly a lot of actually changes started happening. People who didn't want to go under the knife, we had a lot more alternate options in aesthetics.
Yes.
So I was thinking, rather than just risking it all and getting into all the knives and the cuts and the stitches, why not do something nice and delicate, which is actually more convenient for our females, of course. So that's how I ended up in aesthetics, and I'm kind of enjoying it for now.
All right. So aesthetics almost is it's like a form of art.
Yeah.
So you are they're talking to a lot of plastic surgeons who kind of want to go into plastic surgery and aesthetic physicians.
Yeah.
They are expressing a lot of art through their practice.
Yes.
What do you think about it?
Okay. Art for me is a little more aggressive, I would say.
Okay.
My art is not very delicate art, because if in case you actually have a surgical background, you're more interested in doing like thread lifts and more you want to get into the aggressive bit more.
Yeah.
Of course, the outcome is very nice and subtle.
Right.
The outcome is like more feminine and nice. I mean, like that's how we actually want to go about it. But my art would most likely be rejuvenation, right? I wouldn't want to have like drastic changes in a person's outlook. Because the thing is that you just need to add to the beauty of the patient.
Right.
You
Not
don't really want to,
them.
distort the whole image, right? And they can't really look at themselves in the mirror and kind of think that there's someone else.
Who is that?
Yes, exactly. And then suddenly when it starts dropping down, right?
Yeah.
At that point of time, they kind of feel like, what, I don't look the same anymore. And then they go on and on and on. So I don't encourage that sort of an art. I encourage more of a subtle art, but of course, the aggressive way.
Right. But I mean, we went through an era where everybody kind of like overfilled and became somebody else. And then now we are in an era where everything is more subtle. People are appreciating more natural beauty and trying to do it in more subtle ways.
Yes.
So absolutely. So what would you say is your passion? Like, what are you passionate about?
Okay, well, if it actually is that, then I've got bigger dreams, right?
Yes, absolutely.
I've got bigger dreams. I really want to innovate something like a different technique or using a different product and do a different maneuver through which I can actually make a change. And that becomes my method of doing it. Right?
Absolutely.
So, of course, every doctor does something different, right?
Right.
And I'm like, you learn the same thing, but from a different person every time, right? You visit these conferences and trainings.
Yeah.
Everyone's doing the same injectable, the same technique, but there's a slight difference between the hand movement, or there's a slight difference between the grading of the whole procedure. So what I want to do is I want to do something different. Like, I don't know what different, but I would really want to do something different, which would actually just make a huge dynamical change.
Yeah.
I think that's going to be more interesting for me. That's exactly what I'm looking for, be it a product or a technique.
Well, we're going to be waiting for it.
I hope I actually ace it soon.
Well, if you're looking for it, it will find its way.
I mean, hopefully, inshallah.
Yeah. So overall in Pakistan, you practice in Islamabad?
Yes, I do.
What is the name of your practice?
Aesthetics Lab.
Aesthetics Lab.
Yeah.
And what is the procedure? What is one common procedure you do pretty much every day? What are you most known for?
I would say thread lift and skin booster.
Okay.
Right?
Awesome.
I love rejuvenation, of course.
Yes.
Because the thing is, as I said, I just want to add a little beauty to the patient, right? So skin booster is something that, I just encourage every person to get done, right?
Absolutely.
Because the thing is that at the end of the day, after a very tiring, hectic lifestyle that you have, you don't really get good nutrition, you don't really eat well, you don't sleep well, amount of stress that you have nowadays, you're a working woman, then you're a mother, you have a lot of
Vasopressors
things.
and like-
Yes.
yes.
So to counteract all of that, what you want to do is that you just want to add a little more hydration to your
Right.
skin and just like add a little more like richness to the skin. So skin booster is something I always actually recommend. Second,
Just for people who don't know, if you have very busy lifestyle, stressful, not having time to do a lot of different things, but you want to have good skin boosters is the way to go, like Dr. Fatima here mentioned very nicely.
Yes.
And the second thing is?
And the second thing is, of course, thread lift.
Thread lift.
We go around and we come back to that, of course. So the thing is that excessive, of course, when you age, there's excessive skin.
Right.
You lose your fat and the skin drops down, right? And I wouldn't actually want to fill it.
Yeah.
I don't want to fill it up for if in case you're not a petite woman or if in case a petite man and if in case you've got a lot of fat pad already. I think if you have a nice face frame, you just want to get rid of the loose skin.
Right.
Thread lift, skin booster. Done. That's it. I mean, like, yes, pull up the skin.
Dr. Fatima, you summed it up really nicely.
Yeah.
Thread lift and boosters cannot go wrong with them.
Never.
She said it so beautifully. So here, for our doctors, as well as all of my colleagues, as well as patients, everybody else around, you know it now. Thread lift, we were talking about Aptos and Dynamica, as well as boosters like Profilo. Amazing products and amazing results in a very short period of time. Enjoy.